Dr. Nelli Gluzman utilizes a holistic, functional, and an integrative approach to medicine. This approach is one that focuses on the root cause of soft signs and disease in children, which can almost always be traced back to gut health and nutrition. In her experience, focusing on a whole body approach allows for the reversal of a wide range of symptoms and the elimination of long-term conditions. When treatment starts with the microbiome, you begin to see how many functions and systems of the body are heavily affected by what we eat. As the age-old saying goes, you are what you eat. Dr. Mom, as she's called, her patients have nicknamed her, she's dedicated to helping each child live a happier, healthier, and more fulfilling life, free of disease caused by an imbalanced gut. Through her work with the sickest children in the hospitals of New York City, as well as running her own private practice, Dr. Gluzman has a decade passionately dedicated to helping thousands of children and their families rescue their health. So let's see, I'll skip a little bit here. Been a practicing pediatrician in New York for over a decade. She got her degree from New York College of Osteopathic Medicine. She is also the sole New York City pediatrician to be a certified practitioner of the GAPS protocol. That's kind of interesting. On a more personal note, her daughter, whose health she personally rescued and transformed, is a shining star of her life. So great. Well, welcome again. Thanks for being here.
Thank you so much for having me.
So you've practiced a while, but not 50 years or anything. But I wonder if you could speak to maybe this rising phenomena of poor gut health and chronic disease in children as a place to start.
Yeah, this phenomenon is actually an epidemic of chronic childhood illnesses, and it's rising so rapidly that I'm in clinical practice I'm concerned, and there's also a concern that people are just getting kind of used to it and looking at it like a new normal. And what I'm specifically talking about is the rapid rise of kids and adults that have eczema, allergies, and asthma, among other things, but these seem to be skyrocketing in numbers, and kids are not outgrowing it anymore. I always ask my the resident physicians that I teach in an academic center and the medical students that I teach, I always ask them, like, when you were a child, because they're maybe a little bit younger than I, but they're a different generation than the kids now. I asked them, when you were younger, and that was not too long ago, when you were in elementary school, and all you listeners out there, I want you to ask yourself the same thing right now. When you were in elementary school, how many kids in your classroom had an anaphylactic allergy to a food and always had to walk around with an EpiPen? And the usual answer is like, maybe one. In all of my childhood, I've known maybe one kid. And right now, it's about 2 kids in an average size classroom. So that's about 2 kids out of 30 that have an anaphylactic food allergy, and they have to go everywhere with their EpiPen. And anaphylactic means life-threatening. So if they're exposed to some kind of trigger, whether that be plain old peanut or a dairy or an egg or seemingly harmless foods, they're needing to get an injection of epinephrine to prevent their throats from closing, to prevent them from having a life-threatening emergency.
Wow.
Yeah. So the numbers are skyrocketing, and if you're looking at how many kids are suffering with chronic eczema, chronic allergies, chronic asthma, that's really affecting their life, meaning like more than 3 months, officially diagnosed, medications are started to control the symptoms. It's about 10% of kids in the US. So that's a really, really large number. And in some demographics and in some places, it's almost 20% of kids that have things like eczema. And we're not even talking about the kids who are not officially diagnosed with eczema, but the kids that are constantly having rashes, who need steroid creams all the time, even tons of like over-the-counter hydrocortisone cream all the time because of rashes happening. So it's not that I picked this topic to be my specialty. It picked me because most of the kids that were coming into my practice, which is a holistic pediatric practice, were coming in for this reason, just simply because there's so many kids that are suffering with this problem.
Okay. But
you mentioned, like, I know that there are adults watching the show, and I'm looking at the kids and how many of these kids are outgrowing their illnesses. They're actually turning into adults that have the same problem. So 10% of kids, around 10% of kids in the US have eczema, and about the same number of adults have eczema. Yeah, so no one's really outgrowing it anymore. It's not really like an illness of childhood. It's just something that persists and persists and persists.
So you're treating kids, but these kids potentially, if they're not seeing someone like you, are still going to be dealing with the same thing 10, 20 years from now.
Well, hopefully not, but based on just looking at the numbers, it's a lot harder to outgrow it than it used to be for many reasons. So so we need to do all of this is really bad news, and I hate to start off on such a heavy note.
No, it's okay.
News. The good news is that it's actually, yeah. The good news is that these things are reversible. Eczema, allergies, asthma. There's so many things that can be done, especially when a child is young, to reverse these problems. It gets a little harder as people get older, but when a younger child, you can pretty much give the child's body what it needs to heal. It's very much gut centered, and those things tend to go away.
Okay. Well, I want to get into the food in the gut. I know, you're talking about what people eat, which of course in this country and kind of all over the world has really changed. I am curious too, when you say like I didn't have any kids in my class needing an EpiPen when I was a kid. It's true. According to this conference I'm in, and I'll put it on the chat because someone was asking about it. There's a lot of correlation, and I've talked about this before. I'm not sure if you researched it or not, so sorry to put you on the spot, but the introduction of vaccines and then the introduction of glyphosate actually sprayed on food crops, as like there was, and I've known about this for a while, but when they said glyphosate sprayed on food crops and the rise of like gluten sensitivity, I was like, oh, that makes a lot of sense. Like I know that brain has changed and stuff, but I was like, wow, I hadn't really thought about that correlation. How about you? What have you seen in the literature?
Oh, so glyphosates are a big problem, and we're only starting to see the ramifications of what glyphosates are doing. So just to kind of do a little, I'm on the spot, but I can say, so Roundup is it's an herbicide. It was created initially by like a biotech company, and then it was marketed to consumers in the 60s. And so when that happened, everybody wanted their lawn to look beautiful, bought these herbicides, sprayed their lawns with Roundup and similar herbicides, and all that Roundup and all those glyphosates dripped down from our lawns into the groundwater and into the oceans, and then it rains glyphosates now. So we're still in the US, still there, the foods that are GMO, which is most of corn and most of soy, and most of gluten that's not organic and non-GMO, is sprayed heavily with these herbicides that do so many dangerous things. For example, glyphosates disrupt zonulin, which holds the endothelial lining, which is the gut lining, tight junctions, like the tight junctions. Zonulin holds it together, it disrupts it, and that causes leaky gut, where the cells are not able to be stuck together, and they start letting things in through the cells into the bloodstream, causing allergies. And that's why one of the reasons why we're seeing so many allergies. It also crosses the blood-brain barrier the same way, so that causes neurotoxicity, and that could manifest in a lot of different ways in children and adults, like the rapid rise of kids who have behavioral issues, psychiatric issues, autism spectrum, ADHD, ADD, that is all chemicals coming in. The rapid rise of these diagnoses is just, it's real, and it's partially because of glyphosates.
Yeah, and someone put in the note that it would kill all grass. That's actually not true. So Roundup is selective, which is why they can spray it on crops. Otherwise, they all die, right? So it has some selectivity, which is very convenient. yeah, you're right. Those crops are now like Roundup ready, but there's a lot of nuance to it. So, and it's not just for consumers, definitely used in the farming industry. Actually, Robert Kennedy Jr. was just on this symposium, and it was developed first as a solvent, not even for agricultural use at all. And then they found out it kills things, and then they found out like more uses for it as a desiccant, and then later on full crops. So there's a, I did totally put her on the spot. There's a lot to it, but it definitely, she's talking about it causes gut leakiness, and blood-brain barrier leakiness is very well studied. Super, yeah, it's super interesting stuff, and it's it does, like, even when I was a kid, I wasn't gluten sensitive. I didn't know anyone who was, and now it gives me a huge headache to eat. So it's just, some things have definitely changed in our food supply that are pretty concerning. So when you get a new client, I guess it's a parent and a client, are they usually aware of these issues, or are they kind of like sometimes starting from scratch, just eating whatever, non-organic food, that kind of thing?
It varies. So, usually when somebody goes outside of the conventional system, and I am a conventional regular pediatrician as well. So in conventional pediatrics, we have a very limited way to treat these chronic issues. The treatments are all excellent. They work really well. They treat the symptoms really, really well. So if you have a child who has a rash or eczema, and you want to make sure that they're sleeping at night and not suffering and not picking on their skin constantly and not bleeding, then you can use a steroid cream to calm the inflammation locally. If you have a child who's having really bad asthma and they can't breathe and they're wheezing, we have life-saving medications that open up the airway. We have steroids that calm the inflammation in the whole body. But this approach is life-saving and it treats the symptoms, but that's all it does. None of that addresses the root cause of the problem. So when you have parents who come to seek treatment or get information outside of the conventional system, that means that they've usually been failed by conventional medicine. And so they've been on so many rounds of antibiotics because the child is always sick, and they've had all the steroids, and they've exhausted all the specialists, and that approach is not working. Their child is still miserable and they're still worried. So when parents come, they're, either they kind of don't know where to start, which is where I was with my child. When, even as a pediatrician, my kid had these problems when she was 3. I had no idea how to start healing her. This is how I ended up on this path. So either they don't know where to start, or they've done their research, but the world of information out there is just so, there's just so much of it, and it's really hard to decipher what really works that is evidence-based. Plus, there are not that many people doing this for children. So holistic medicine for adults and functional medicine for adults is blooming and blossoming, and there's so many amazing practitioners. But for pediatrics, it's very few in between. And when my kid was sick, I only had an option of one holistic functional pediatrician in New York City, which is a really big place.
Wow.
And I had to wait like 7 months to see
Oh
him.
my
So
God.
yeah. So
You're like, here's a niche that I should maybe tap in. But you weren't looking for yourself yet. You were just looking for her.
yeah, I was really worried about her. I was on like 7 courses of antibiotics in 1 year. So every
Wow.
little virus would turn into a bacterial infection. That's not normal. So she's well now. I had to figure it out, and then I kind of became obsessed with this whole process. How can we not realize in conventional medicine that treating the symptoms is just half the solution?
And how old is your daughter now?
She's almost 9.
Almost 9. Okay. You mentioned it was when she was 3, and I think it's often when, when things can develop for kids is pretty young. One thing I always find suspect, and I wasn't well trained on this when I was a new mom, is often those first few foods like we give our kids are just total garbage, like goldfish crackers and stuff like that. And you see it everywhere. Like if you go to a park, every mom is giving the kids those kind of snacks.
Yes, so that I think we could do like a 2-hour talk on that. So, there's one school of thought that says, let's start babies off with rice cereal because it's kind of easy to digest, hypoallergenic. But what we're doing is giving our child very highly processed, shelf-stable shell of a food that used to once be alive, which is rice cereal, that sits on a shelf forever. And if you actually look, all I'm asking you parents who are listening is to look at the ingredients of what you're giving your child. Just look at the back of the box. Even if your pediatrician recommends it as a first food, look in the back of the box. The acetic acid or the acids that are used in baby food as is not a vitamin, it's a preservative. And at the same time, it's preserving whatever's in that little bottle is preserving the microbiome of your baby's gut and disturbing it in a way that shouldn't be disturbed.
Oh, wow. You know, and those foods like cereals and Cheerios and so they're like the highest levels of glyphosate too, like by far when you look at different charts. So I don't think parents think about that. And they're trying to be good parents. I'm totally not, you know, criticizing anyone. They think, oh, it's easy to digest and all that. But I think you can look at the label and also think about what doesn't even have to be on the label, which is like all the stuff they spray on food and if it's GMO and stuff like that. So when I was younger, I was more interested in, you mentioned GAPS, but like kind of like primal diet. And they talked about more like giving liver to kids early and giving broth. And I don't know if my son would have eaten liver early on, but they claim that that's possible. What do you suggest as like alternatives to things like rice cereal?
For all kids and especially kids who have I'm seeing a lot of babies that have eczema and they can't, or they have reflux, which is all stemmed in gut health. And so if or constipation, or they need to be on like Zantac or some kind of medicine all the time so they're not spitting up a lot and they're gaining weight. So especially for a child that has any kind of medical problem that's chronic, not like something that happens once or twice, but something that's ongoing, like severe eczema, and I'm seeing so much of that. You have to be very, 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 very specific about the types of foods you start with, because that food is the difference between giving your child the building blocks they need to heal versus continuing on this journey. So if you want your child to heal, you have to give them what they need to heal. And in this case, what works best are stocks, bone broths, and livers is actually excellent.
Oh, I like it. Okay,
it's one of the first foods that I recommend for children. One of the first few. I mean, everyone's comfort level is different. You know, you could do a hybrid version. Every family is different. Everyone's abilities to cook is different. So I kind of custom tailor a plan to everybody. But the most important part is to really know, to be an empowered parent and to know the difference between foods that are junk food, even if they're marketed to babies and parents, versus real food.
Yeah, I'm really shocked some of the things I fed my son when he was little, but I just didn't know this. Like even in my schooling, and I went to acupuncture school, the nutrition wasn't really taught, I don't know, in a way that applied to modern life, I guess you could say. And I think even then, which was like 2000, I don't think we fully had a sense of like, at least not that was being taught, of food quality and things like, you know, dairy sensitivities and gluten sensitivity. So I just wasn't really, I just still wasn't really aware until probably, developing health issues, which is often how a lot of us develop it. So I want to talk more about these particular conditions and how they develop. So you mentioned like leaky gut, leaky brain with something like asthma, eczema. What was the last one you talked about? Allergies. What's like the common thread of how these diseases develop?
So to kind of like simplify it, the gut is the foundation of your entire health. So if the gut is not healthy, nothing else will be healthy. And there's no supplement or probiotic that you could possibly, or any kind of medicine that you can find that will fix the problem that is caused by a gut that is not working well. And when I say working well, I mean the microbiome, which is the bacteria, but also the viruses and all the yeast that are both beneficial, like the friendly bacteria, and pathogenic, the not so good guys. So that needs to be with a wide diversity. You need to have a large amount of different kinds of microbes microbiota in the gut to be healthy, and you need a lot of good guys. That's like your bifidobacteria in babies, that's your lactobacillus in everybody. And otherwise, you're going to have a lot of the bad guys that are pathogenic and hurting you, like C. diff or E. coli that's overgrowing, or yeast that's overgrowing. That's one part of it. The second part is to make sure that the lining of the gut is very, very much intact, so that when you eat a food or you're exposed to environmental, seemingly normal things like grasses and trees and dogs and cats and all sorts of different kinds of foods, these molecules are not getting into the bloodstream because the cells are letting them into the bloodstream because the integrity is compromised. So when the body sees all these large molecules that shouldn't be in the bloodstream, they mount a very appropriate immune response. That immune response is your allergies. It's saying, I see so much of this, I shouldn't be here in these large quantities looking like this. It's an invader. I'm going to mount an allergic reaction. And that's why we're seeing so many people, kids and adults, with allergies, to the point where people don't even think that using over-the-counter allergy medicines is a problem. But what it's really showing us is that there's underlying inflammation, that the body's immune system is in overdrive. So to heal the gut, it's pretty simple. You really just need to do a few simple things to make a really big impact. So what I mean by that is we have to remove all the things that are not food, like extra sugar, food colorings, preservatives. We try to eliminate that. Sometimes I put children on a temporary gluten-free, dairy-free diet just to calm the inflammation for a short period of time. And then we use stocks and broths made of really healthy animals in a certain way where we incorporate the whole animal to heal and seal the gut lining. And then we replenish the microbiome with fermented foods, which are the most potent probiotics that you could possibly find anywhere. That's basically it. Without doing these simple steps, no supplement is going to be the magic bullet. No functional medicine test is going to tell you what you need to do, and you do that, but you need to do those primary simple steps first.
I love that. And is that in a certain order? Like you wouldn't do fermented foods right away, you do those later, that kind of a thing?
Yeah, so I'm running what I've been doing with my patients one-on-one, and I do group classes as well. I have like a 30-day program. It's called Rescue Your Child's Health. So I put everything in order step by step. It's a 4-week program where first we remove the things that are not serving us. Then we replace the nutrients that are lost, especially for children. And that means eating lots of colorful, fresh, local foods, maybe juicing greens, whatever is appropriate for a certain age. And then we heal and seal the gut lining with stocks and broths. And finally, last part is on top of that well-healed, sealed gut lining, we add the ferments to restore the microbiome.
Okay, I love it. Is that kind of the GAPS protocol, or have you sort of changed it to be your own?
So yeah, the GAPS protocol. So the GAPS protocol, the gut and psychology syndrome protocol, is like a outshoot of something called the specific carbohydrate diet, which is a very comprehensive way to heal the gut and reverse a lot of chronic problems, not just associated with psychology, but any physiological issues like autoimmune disease, any chronic problem that is not something that you're born with, not congenital. So if you want to heal the gut, you can do this very aggressive, very hard to do approach because it's very limited, and most families can't really do that. It ends up being too difficult, and the child is really not sick enough to have such a restrictive lifestyle where you eliminate all like fiber from the diet for a while. So it's really hard to do, and a program is only as good as what a family can do. Like if it's too stressful or too hard, and it's pointless because it's not going to get done. So this is I studied this protocol. I'm the only pediatrician that does this protocol in New York, but I found it to be very limited. So I take elements from there, but I make it livable. So you get all the benefits from it without sacrificing your or your family's life. it's doable for anybody. It's accessible to anybody. You don't really need to buy anything extra. There's no like list of really long supplements and vitamins to get. Nothing. It's just basically using the right foods at the right time in the right way.
I love it. Yeah, I think I've heard the epithelial layer replaces itself like every 1 to 3 days, something really quick. So sometimes it's like giving your gut that break. I think it was this winter. I went on this like rampage where I was like, suddenly I can eat all the corn tortillas and cheese that I want. And then that caught up with me. And I really had to just have I just did fasting, I did broth, and I just needed that for a few days to because anything I put in would just, everything would get inflamed again. So sometimes that's the bad timing.
What ends up happening is like the program is for kids, but the whole family does it because they want to be nice to the child and not eat all the stuff around
a hamburger in front of the kid. Yeah.
Yes, so the whole family does it. Everybody feels great. So,
yeah.
and I also find it interesting, like some parents are gonna say, my kid is super picky, which they might be. They're not gonna have broths, they're not gonna have the stocks, they're not gonna have the greens, but maybe in the beginning they won't, but eventually 99% of kids, they end up feeling so much better that their body craves these things. So it's actually quite surprising how how non-complicated it can be, even with a picky eater.
It's true. You do. I guess I can't speak for kids like you can, but for myself, yeah, like I'm on a great eating kick now, and I'm just like craving green so much, and I'm also craving steak, but it's a really clean steak. So yeah, I wanted to share. I saw this eczema commercial last night, and we've all seen them, but for some reason, this one just really was getting under my skin. So it was for adults about some medication you can take for eczema so you can get back out there, live your best life or whatever. And I was just like, it's just such a shame to me that someone could be a grown adult and be like stuck on this medication and not know like all these root causes that we all know. And even probably everyone on this entire call knows at this point because they're educated. So yeah, it was just one of those commercials. It was just like you said in some info you sent me. It's just like a Band-Aid. You're not really understanding why you have the eczema, and it is possible to heal it with most Americans have never done this kind of gut reset like you're describing. I like the idea of doing it as a whole family. Some of these things do kind of run in the family too, like tendency to eczema. Not to say it's the only thing, but everyone in the family probably could use a reset, right?
This tendency, this is actually, it's my pet peeve. So a lot of practitioners say, like a lot of regular doctors, maybe allergists, dermatologists, they'll say, oh, your kid has eczema or allergies or asthma because it's genetic. And yes, it's true that there's a genetic predisposition to these atopic problems. Like if a parent has eczema, there's actually a 40% chance of having this problem for a child, but it's not 100%. You can do so much to control for the environment, both inside your child's body and outside your child's body, that is empowering. You don't have to sit there and go, well, it's genetic, there's nothing I can do, this is their lifelong fate. It's actually quite dangerous to tell parents this, that it's just genetic, so nothing else you can do.
Right.
What about epigenetics? As if it doesn't exist. Epigenetics is how the environment influences genetics.
Right. It's kind of the lazy way out, so to speak. So you went to an osteopathic school. I don't know how much different that is than a traditional school. Let me just ask that first. Was there any more like holistic kind of alternative stuff mixed in with your education?
So it's osteopathic schools there are fewer of them than allopathic, so there's less of us because there's fewer schools that teach an extra class of which is osteopathy, which is how the structure of a body affects function.
Okay.
So extra class.
So more in the physical structure of the body. Okay. So now you've had all this extra education, so to speak. Now, if you talk to some of your traditional peers, are they curious? Is it a mixed bag? Like, what are you finding?
Oh, I love this is so what I'm finding is, I guess it's not a bad thing, but you know, practitioners in the conventional world want to see evidence-based medicine, so they want to look at studies, and then they're like, let's say it's an allergist, so they have their American Academy of Allergists, which puts out recommendations every year to how to treat the best way, um, based on evidence that was collected with excellent studies, which is so good that we do this in the US. We're not just treating willy-nilly. We have standards that we must uphold. We need to have evidence in medicine behind every action. So all the studies that we have, almost all, mainly almost all, are studies that show efficacy of certain medications for treatment. But none of these studies, not none, but very few studies look at the root cause of treating something. So they're going to say, yes, these are the best protocols to get rid of the symptoms of these issues.
That's a great point. It makes a lot of sense. So
Well,
that the study is based on the medication. So
yeah.
that with that starting point, you're going to go to the medication as long as, okay, it was effective, there weren't that many side effects, etc.
Yeah, there are, I mean, there are studies that are like, you know, remove gluten or remove dairy, and then they look, but those are not really that they don't have that much power behind them. They're not usually studies are sponsored by a medication company or its affiliates. So there's a lot of gray area. Like they're useful. We need to have this. We need to have these rescue medications, absolutely. But it's the wrong field if you want to get rid of the problem permanently. It's just
Right, right. And it doesn't fit the paradigm. Like, I think people get into medicine for good reasons, to help because they're intelligent, you know, they want to serve, but they're taught a certain paradigm. You were the same, you know, and then it doesn't fit. Like, if you have 5 to 10 minutes with a client, right? You're trying to teach them the GAPS system. It's not, no, there's no time for that. And maybe the client isn't even open to it. They came here for something simple. They're busy, they're working full time. Like, they don't want a doctor to tell them all these diet changes. So it's just, yeah, it's interesting, but it's a great, you pointed out, there are so many studies on PubMed about gluten and blood-brain barrier issues and toxic. I've been doing a lot of research lately because I'm writing a book, and there's so much information out there, so much study. But I think the application of it is generally not that simple. So maybe that's what
like you can't, yeah, it's also so slow. You could use a cream,
yeah.
an inhaler, you'll see a result right away. Awesome. That's great.
Yeah.
So it works. Healing takes time. It takes as much time, if not longer, to get to the, you know, to reverse a problem than how you got there. So it's hard to tell what's really working. There's a lot of trial and error. Everybody's different. There's not one magic bullet. There's not one solution that works for everybody.
Yeah, yeah. I'll share my recent asthma story because I think it's kind of a fun example. So I had some asthma when I was in college. That went away. I made some lifestyle changes for that, but it went away for like 20 years, and I just didn't even think about it again. And then when I moved to Arizona, I very slowly realized I wasn't breathing well. Because it's not always so obvious, right? I was just tired. It's like weird stuff was happening. So I ended up in the urgent care, and things kind of came to a head, and I got some inhalers, which work really well. Like you said, like instantly. And when you can't breathe, it's kind of pretty scary. So it's seasonal for me. It kind of comes and goes, but similar is like, I want to fix this naturally, but I'm already doing a lot. I don't know why it's here. You know, I have been exposed to mold, like whatever, like somehow I'm having, but I just kind of didn't know it would fix it. But recently I listened to a talk on leaky lung, which is a subject I didn't know much about. And he was talking about that barrier, and that some people who have asthma or other conditions like COPD have this leaky lung. And he said the thing to make it stronger is just these antioxidants like vitamin C, vitamin A, glutathione. And I was like, I basically have all those things already. Let me start taking them. And like I would say within like 5 days, I didn't need my inhalers. Like that's pretty freaking amazing. So sometimes it's just you haven't found the right combination of things, like you said, and it takes some persistent. So that was like a big win for me, and I'll sing that one on the rooftops. I've also started the onion and honey thing that a guest of ours recommended a few weeks ago. But yeah, it's like such a huge win to feel like, oh, I'm stuck with this thing, I'm on steroids, and then see it go away. It's amazing.
Yeah, and it's not wrong to use conventional medicine. The point is you can do both at the same time. You can use your medications that make you feel better, that make your child feel better. Yes.
Yeah, yeah.
But if you're not doing something to reverse the root cause and to give your body what it needs to heal, then you're gonna end up in the same problem with the same problem, like in a week or 2 or 3 or
Yeah.
multiple times a year, or maybe next allergy season, but worse.
Yeah, and I'm going to definitely keep my prescriptions current because, things could flare up. Like last summer, there were all those fires everywhere. There's
Yeah.
things that can happen that would be really challenging. And I'm glad if I have some stronger tools when the time comes, for sure. These tools can be like life saving, really life changing. So yeah, I don't want to poo poo it, but I think it's so great. Tammy asked a question in the Q&A. She said, her 10-year-old, it sounds like he used to like salads and now he doesn't. what can she do for him? Get him eating salads again.
So you could, so one way to, you don't have to make your kid eat salad. You could throw it in a smoothie and hide it, and basically that will work periodically.
True.
You could hide it in food. When I sometimes I'll make like I make juice all the time. I'm obsessed with juice, and it's part of the protocols that I put kids on. I have them drinking juice with lots of greens, like real fresh juice from home, and so they'll get their phytonutrients with a cup of juice. So it might not necessarily need to be in that form, and or you'll take the fiber as part from juicing, like all that pulp, and you could mix it with an egg and make it into a patty and fry it.
Oh, interesting.
Which is actually really yummy for like even younger kids.
Huh. Yeah, they need that fiber for sure. And like my son will eat a lot of like berries and apples and stuff, but he's also gotten little pick. I said we feed our little ones a lot of junk, but also little ones real little ones kind of try anything, which is amazing. And maybe what Tammy's alluding to. And then like my son too got a little pickier as time goes by, but he does still like salad. Sometimes we'll make little rules about this sounds so simple and like kind of lazy, but I'm like, you need to make sure at least one vegetable, one fruit got into your mouth that day, and that's pretty simple to follow that one. Obviously, it should be more than just that, and mom can be making smoothies or different things, but it kind of helps him like check himself, when they're at that age. Because my son was getting a little skin thing and it's gone now, but like I was like, he's probably not getting enough fiber. I better get on it.
Yeah, and also like at 10, I feel like a lot of 10-year-olds around that age, they're empowered by the whole process of like if they help you cook or they're responsible for the salad, they're gonna probably eat it.
Yeah. If it's what's for dinner, yeah. Tammy was also asking, is it allergy season? She's having sneezing and runny nose. I'd be curious what, I feel like allergies are different in different places and all that. What's your opinion, or what do you have to say about, I don't know, like seasonal allergies and that kind of thing?
I think so. I don't know if, sneezing and runny nose could be a cold, it could be allergies, it could be, ask your pediatrician about what's going on. But allergy season, it doesn't, like, different kids and adults have allergies to different seasons. So there's really no such thing. Usually when things are blossoming, that could be in different parts of the world at a different time. When something's blossoming, that is usually something that triggers a lot of people to have reactions like hay fever. But it's the point is that it's not normal to have allergies, that allergies are a symptom of a bigger problem. So even though there's medications available and everyone in the office or everyone in school is having allergies and it's no big deal, oh, it's just my allergies, it's actually a big deal because that's the start of something bigger happening, and that could cause bigger problems down the line, and allergies will get worse if you don't fix them.
Yeah, that's a great point. I want to ask about the allergies getting worse, but I think it's also like a combination, right? It's not like, oh, pollen's out to get me. It's like your immune system's overreactive, maybe your gut's not healthy. For me, where I live in Arizona, it's in the top 5 worst air quality in the whole country. And you wouldn't think that when you're here, but I think that combined with my mold history and this leaky lung I might have developed, plus now then the pollen comes, it's like just too much for me. So I have to like unwind my own root causes, like you've talked about. I know in the autoimmune world they say once you've developed one diagnosis you'll get more. With allergies, do you tend to accumulate like more and more
Yeah.
sensitivity?
So there's this a concept of the atopic triad. So when a child or an adult has eczema, they're more likely to have asthma. They're more likely to have allergies. So those three are linked together. So if you have one, you have a tendency to develop the other two.
Oh, I see what you're saying.
Yeah, and well, actually, I mean, if really, in a way, it's the same thing. Both autoimmunity and allergies and eczema and asthma, they're all coming from the same problem. It's an over-responsive immune system. Why is it responding so much to seemingly normal things like your own body in autoimmune disease, or grass and trees, or cats and dogs, or food? Why is it? Because there's something in the bloodstream that shouldn't be, that the body is responding to. And when you have a lot of allergies, the body gets really confused about what it's seeing. When you have a lot of things getting inside the bloodstream that shouldn't be there, the antibodies get confused and start attacking the normal organs.
Yeah.
Autoimmune disease in a nutshell.
Yeah.
That's why, yeah, and that's why you're more likely to get other autoimmune problems, because you need to heal the root cause of this issue.
Yeah. Yeah. And with kids, I don't know if you talk about this in your practice, and you probably do, that indoor air quality is so important for them. And I just read some studies on pollution, leaky lung developing, toxicants and blood-brain barrier. So they're a little more affected. I mean, we're all affected, but they're a little bit more sensitive in some respects. So having that good indoor air quality for them. My audience knows this, but if someone's finding this for the first time, not using fragrances, changing your air filter often, having a really high quality one, wet mopping, avoiding like synthetic carpet and all that stuff that off gases, can really make a difference for kids.
Yeah, kids are so much more susceptible to air quality. I have a whole chapter about this in my program, about indoor air quality, because it's such a big deal. Kids are so much more susceptible to toxins in the environment, especially indoor air quality toxins, for a number of reasons. Number one, they breathe so much more than adults because they're smaller. So their normal respiratory rate, how many breaths they take in a minute, is higher than an adult. So if there's a problem in the environment, in the air, they're going to breathe it more. And they're young, and their systems are not as mature, like their detox systems, their livers is still developing. It's not fully matured to its full potential. And they have a longer life in front of them. So the damage that's being done now is going to affect them for a longer period of time. So kids are not little adults. Their risks are way different. Or if you're using like toxic chemicals on to clean the floor, and then you have a child that's just learning to crawl on that floor, that exposure is going to be much bigger. Or if you have a lot of like fertilizers on lawns and grass, kids are the ones that usually end up there more, running on that.
Yeah, they're on the ground, they're putting things in their mouths. There's a lot of differences. So your website is linked here in the chat, and we'll have it on the YouTube video, and a program that you offer that I think you've kind of alluded to with a discount code. So thank you. We do get questions about like local practitioners and all that. So if remember Dr. Gluzman's name. So if you want to refer her, do you work online now too? Thanks to COVID.
Yeah, I'm doing hybrid, both in New York and New Jersey is where I have practice in both locations.
Okay, yeah, I think it's a great program. It's great, but at the same time, sometimes people for that peace of mind want to speak to someone one-on-one, so that's great. Maybe I'll let this be the last question. Do you use homeopathy at all?
Oh, I love it. Yeah, I do. Big time. I'm a
Okay,
huge fan.
cool.
Because we don't actually have that many safe holistic options for kids. Like a lot of really great supplements can't really be used for children. But I'm a huge fan of homeopathy, and I would die without my arnica after working out, and it works really well and it's safe, and I use it all the time to help kids like detox if they're having vaccines.
Oh, awesome.
So, yeah, like a combination of different needs depending on what the problem is. So yeah.
Yeah, I love them too. And yeah, kids can be it can be a little trickier to pick what to give them, and then they can't swallow pills. So I always kind of tread lightly, but there are still so many options. I'm a big fan of like detox techniques, and a lot of those can be used for kids a lot safer, like using the sauna for a short amount of time or whatever. And so it's nice to have those tools. There's always tools when you start looking. There's always options,
Detox
right?
baths, putting
Yeah.
something in a bath that is going to help detox. Benton,
Yeah.
Epsom salt, or even better, like Dead Sea salt, magnesium flakes, things like
It's
that.
funny you mentioned that because I do a lot of Epsom salts, and I was just thinking about like I should look more into like activated charcoal as like
Oh yeah,
a foot bath or something. And you mentioned
it's so
clay.
messy.
Oh, I'm sure the clay might be better as a better option. I don't even know why I was thinking of this. I think I was just like, there again, I have a lot of tools in my toolbox, but there's still more out there, and it'd be cool to have some cool foot bath options that you could do for kids and stuff like that. Awesome. Well, I really enjoyed meeting you. I love the information. As always, we always put this on our YouTube afterwards if you want to refer anyone to it, or you are like, what was her name again? You can always go to our YouTube and find that. Thanks for everyone who was on live. Thanks, Dr. Gluzman. We really appreciate your time.
Thank you. It was so nice to chat with you in person.
Likewise, I know. I feel like we know each other. I'll see everybody next week. Let me just quickly tell you what's coming up next week. We're talking about menopause and hormones and herbs with my good friend, Dr. Snyder, who just has a new book out about holistic menopause management. So it'll be really great if you need some tips. Again, even if it's not exactly your demographic, you might be there someday, or you might know someone who's there, and we'll talk about managing mood with herbs and sleep tips and some fun things like that. So bye, everybody. Thank you. Thanks, Janet.